We're going to discuss how to properly administer lidocaine to the skin to anesthetize locally for procedures. This is oftentimes one of the first things you will do for the patient, and it will be the first time you puncture the skin. For the purposes of just orienting ourselves, there's a few things to keep in mind. One, it's generally recommended to use buffered lidocaine, 1 part sodium bicarbonate to 9 parts lidocaine. Oftentimes we use 1% lidocaine, like we have here. And the thought of using the buffering is because lidocaine is acidic and it can be painful when you're administering it, but when you buffer it, this kind of addresses the actual pain of giving the lidocaine. So we have our buffered lidocaine here. We have a 25 gauge needle here, and then for the purposes of our demonstration, we're going to be using a piece of dried apple. This probably won't make a wheal as well as real skin, obviously. You could use something like maybe a piece of chicken that has the skin still attached as well too, to practice making your wheels. But we'll give this a shot just because we don't have to worry about refrigeration or meat contamination, and it's still a good, medium to practice on. All right, so we're gonna focus first on making the wheel, and then we can talk about some other things about administering lidocaine. But the wheel is especially important, and just remember, making the wheel, it's an intradermal injection, kind of like placing a PPD, and that's important because that's where the pain receptors are. So it's really important to anesthetize that layer well.